Hi, good morning, everybody. Welcome to today's Educator Workforce Programme, Equality, Diversity and Inclusion webinar. My name is Beverly Powell and I'm the Strategic Lead within the Educator Workforce Programme. Thanks very much for being here. As part of our ongoing commitment to embracing EDI as part of our clinical educator workforce development, today's webinar will highlight practical examples of how inclusive leadership and thoughtful service design can lead to meaningful improvement and positive outcomes. We are joined by three sets of clinical educators who are Olivia Clark-Smith, Maria Reynolds, Laura Clifford, Kerry Woodcock, Noor Nixon and Anthony Hill, and they will share their experiences of implementing changes that reflect both workforce needs and the diverse communities that we serve. EDI sits at the heart of the Educator Workforce Programme and is a core enabler of our workforce sustainability, innovation and bringing about equitable outcomes. Today is an opportunity to learn from practice, reflect together and consider how we can continue to strengthen inclusive approaches across our systems. Please use the chat function to share any questions or reflections throughout, if time does allow, and we'll pick these up at selected questions towards the end. This session is being recorded and will be uploaded onto our NHS Futures Educator Workforce Programme. So you will get access, you just need to register. And once again, thank you for your engagement. And now I'd like to hand over to our first presenters, which are Olivia Clark-Smith and Maria Reynolds, who's going to talk about NETS drivers. Thank you.
Sorry, just trying to cope with the technology. Can everyone see my screen now? Fantastic. Let's go to presenter mode. Marvellous. So I'm Maria Reynolds, and as you can see, my colleague Olivia Clark-Smith with us, our practice placement manager at University Hospitals Birmingham. And today we're going to talk about NETS, the National Education Training Survey, and how it's driven cultural change within our department. What you may or may not be aware of, NETS also links with the NHSE intensive support framework, which, as you can see here, has 4 different levels, 0 being the one you want to be on, where there are no concerns, and 4 being actually where they can suspend you as a training site for students. And obviously there's the 3 levels in between. I'm going to take you on a bit of a journey of our experience, starting back in 2022 when the NETS survey happened. And here's a snapshot of our results. Our trust is a very large one, in fact, the largest in England, and it's across 4 hospital sites. And you can see the whole trust has got the results on the left and it's one of our single sites on the right. Pink is not great, red's really bad. And you can see that we had 20 respondents overall across the whole trust, but 9 of those respondents on one single site gave us a bit of a sea of red. This then triggered an HEE visit at that point. To come and see us, to see what's going on, what's going on that's making our students give such bad responses. It is important, I think, to note at this point that we had 9 respondents out of 58 students who were regularly coming to us on that site at that time. So quite a low response, really. So we had a virtual visit that happened in May 2023. This was where the students were met, as well as key members of staff and educators and senior leaders within our department. You'll see on here that then triggered us to move from level 1, from when they planned the visit, to level 3. This wasn't because there were lots of different things wrong, but in particular there was one thing that was quite seriously wrong. And as you can imagine, as this webinar is about EDI, it centred on ethnicity. This just gives you a timeline of what happened next. Obviously, we had various actions. There was another visit and review. We had more NETS surveys. We moved down to ISF2, and then eventually in summer last year, we were removed from the framework back to level 0, which was a great relief to us. I'm going to be really candid with you because it was quite a confronting time for all of us. And the first thing that we did was we went across all 4 hospital sites and met with as many members of staff as we could in various staff meetings. And when you consider we have over 500 radiographers, that was quite a feat in itself. But what I did was I took this letter, which I'm about to share with you, to them and shared this actual slide with them to give the details of the feedback that we've given on that report from our students. We were very aware that when the report came out, it would be in the public domain, and this could be picked up by media, and it would reflect on us personally and as a trust in our reputation. We all identify as being part of UHB imaging department, and therefore we took this all quite personally. So I read this out, and I'll leave you to read the detail of it. As you can see, it was really confronting. This opened discussion. Some of our members of staff opened up as well as some of their experiences as well. We talked about the fact that this was anonymous. We couldn't actually do anything about these specific examples, but what we could do, and I challenged everybody to do, was to think about our behaviours at work, how we treat people. When you're having a bad day, do you sometimes take it out on the lowest denominator, which may be the student in the room? Is that because of a racial motivation or something else? But really just reflect upon our behaviours and what we do. We realise we need to think about how we're looking after our staff and so that they can bring their best selves to work. So that's obviously the bad bit, the confronting bit, and it was probably the most important bit as well, because it started the conversation and it started us on our journey of recognition and collective responsibility for how we were unfortunately making our students feel. We also were aware that we needed to make them find a psychologically safe place for them and trust with them, so they could come and with us with individual issues, so that we can actually tackle them at the time. So what did we do? In the department, we brought in an external speaker. She met with the students first, and then she met with members of staff on the site in question. She talked to us about equity, diversity and inclusion. She brought actual feedback from the students and challenged us, again, more listening, more discussion. It's okay to talk about equity, equality, diversity and inclusion, as long as you do it in a respectful way. We used appreciative inquiry for to do workshops about excellent learning environments, as you can see here. We did a series of those. If there were no barriers in front of us, what kind of environment would we want to create, and what can we as individuals do to make an impact on that? It's not just about the management and leadership that has a part to play, but what can I as a single radiographer do to make it better? We did some team building. We were aware we wanted to build our team and make them feel safe as well. So we used like escape room type scenarios called Lost in the Wilderness, and our organisational development team came in and did those for us. We also wanted to appreciate each other and make it be a positive place to work. So we created our appreciation sunflowers that you can scan the QR code on, and that created then our appreciation balloons. You can see the display with the skeleton there, and those are displayed around our departments with small comments and thank yous for different members of staff. Thank you for swapping a shift. Thank you for helping me with something. Our students input into that to thank their supervisors. Our supervisors do it to thank our students. It's a really beautiful display, and we keep it updated. And as we change the balloons, we can then give the balloons to individuals as a little memento to remember that they are appreciated and we do think of them. We also created a virtual suggestion box so that staff had a voice, they could be heard. If they had ideas, we could do things to improve the situation. Wellbeing obviously was a big centre. Our trust has different wellbeing hubs across the trust, but also we commissioned an emotional resilience training course. Over 150 people went to that. It's the most well evaluated course, and you can see some comments from that course there. It was an opportunity to think about what are the indicators of you being under stress to prevent people getting to burnout, but also what can I do to look after myself, that self-care. It's that moment of putting on the oxygen before you put it onto the child beside you. So how can I look after myself so I can bring myself best self into work? We also had wellbeing champions. We still have wellbeing champions, and we did various activities and we asked people what they would like. And it can be from a simple thing, from playing a board game at lunchtime and getting conversation going and support and making those connections within the staff room, to bringing in companies. This is the one that everyone loves, that do a half-hour massage to people and throughout the working day, which has been a really great thing. But different team building things that we could do. In parallel to that, the Trust was also undertaking a cultural change, and they created the WISE Council within our Trust. Both Olivia and I are members of the WISE Council, but actually anybody can be a member of the WISE Council, and that's where the magic happens, I suppose. It doesn't matter what your role is, your voice can be heard, and that can be from anything about hot topics like car parking to also sexual misconduct and safety within the workplace. There's also attached to that a cultural inclusion delivery group, which is chaired by a chief executive. So we also have direct access to our chief exec. The Trust has had last year the year of leadership, which meant we had lots of leadership training in different guises. And this year it's the year of empowerment. We've had various conferences take place, as well as nurse scholarships and fellowships. Again, how we make our staff feel valued, that they can input and do some research, some innovation. The Trust also created our behavioural framework that's connected to our Trust values of kind, connected and bold. And you can see here, it's actually spelling out, what does that mean? What is an acceptable behaviour and what is an unacceptable behaviour? And we've done lots of training for senior leaders, and that's cascade training that's happening. We've included it within our induction as well. And you can see there's even further drilled down elements for that. I was also conscious that we needed a place and a safe person that our students could come to. And so I was lucky enough to employ a practice placement manager. I'm going to move across now to Olivia now to go through her slides.
Hi, my name's Olivia. So I'm the practice placement manager for our radiography student. So I came into post the December 2022, just after the net survey happened, which was quite an overwhelming thing when we find out we're having an investigation. But for me, it was really important that the students know there was one dedicated person that they could turn to whenever they needed somebody. And a part of that was making sure I was easily accessible. So every Friday I send the students the exact site I'm working on, the office I'm in, the time I'm working to and from, any dedicated student sessions we had, and making them know, even if I'm on a different site to them, they can ring me, Teams me, email me, phone me, and I was there for them. Next slide, please. On one particular site as well, the students found that it was quite distressing that they sometimes only get maybe a week, 2 weeks notice on rota. So we wanted to change that. Something we'd done on the other sites previously was to give them an entire year's rota, and that was really important that they got received that. So everybody now receives an entire year's rota from September to September, so that we can make reasonable adjustments. So actually, if someone's got to pick up a sister from school, if they need to sort out childcare, if they've got a part-time job, all those barriers that people struggle and cause absences, we could help reduce that absences and make sure people stay on track to be on placement. Next slide, please. Because we looked after so many students, it was really important that we monitored them. So I have a spreadsheet. We look after about 140 plus students. So this will have they got an action plan, a support plan? Do they have a cause for concern in place? Have they got any positive comments, any negative comments from staff? Is there a safeguarding issue, a wellbeing issue, an EDI issue? And how many times are they seeing me? So every time I see a student, I literally put it on my spreadsheet, and it's a lovely way to see that I'm making sure I see all of the students and that everybody's engaging, but also if somebody's not engaging, making sure that I go and see them and try and find them. We also implemented a BSOL-wide evaluation form. So it wasn't good enough just to wait for the next results to come out to find out how we're doing. We needed to know right away. So we wanted a live system that at the end of every placement block, students can scan the QR code and give us anonymous feedback. And I tell them, this is my to-do list. If I don't know we're doing something really well or something poorly, how to improve it, I don't know unless you tell me. So creating a really nice anonymous channel for them to do that. We also implemented learner passports. So the moment a student comes on our site, they can let us know what their strengths are, what their weaknesses are. Do they have a university support plan, a dietary need, a religious need, a care responsibility? So from the get-go, we're giving them a voice, because what we found is sometimes people are afraid to share these things because they thought they'd feel almost inconvenient. But we're saying, no, we really want to know so we can support you. And we offer them a one-to-one confidential chat from the moment they get here as well. We did lots of work with our supervisors about how to give constructive feedback. feedback, because we all know giving constructive feedback is an art form. And also telling them every day, you need to give them feedback. They're a student. They're not supposed to know everything. They constantly need to improve. And also telling our students, expect feedback, and asking them, are you empowering them to learn? So if they're not engaging, are you trying to engage them? Have you assigned them a supervisor? Do they feel part of their team? Is their name on the rota? Are their name on the lunch breaks? Making sure they know they are not called the student. They are called Jane, Bob, whatever their name is, because that's not who the student is, not their identity. They are a person. We then outlined expectation posters based on if you were a supervisor or a student. So we all had the same standards to adhere to. So if at any point anybody didn't adhere to those standards, we could say, actually, no, we need to raise this as a concern. Next slide, please. One of the things that didn't evaluate very well originally in the NET survey as well was our nursing placement. So our first year radiographer students go on to nursing placements, and it was really overwhelming for them. So we've done a lot of work to do sessions beforehand to get them prepared for these, and we've heavily involved the nursing team. So we've collaborated together, and they get lots of wellbeing check-ins during these weeks, and it's been really well evaluated since. That's been absolutely fantastic. Next slide, please. We also wanted to get better at saying thank you to each other and appreciating each other. So one of the things we implemented was student radiography awards. So if a student was working exceptionally hard, you could scan the QR code and say, thank you, that was really phenomenal care. They get a CPD certificate that goes in their portfolio, and vice versa. If someone had been a really great teacher, they could be nominated from the award from the students, and you can see these beautiful things that we got. So we managed to get them star badges, a visual representation that a student could see, this person's been nominated for a teaching award. They're really approachable, they're a really great teacher, I'm going to go and talk to them. But also you can see from the smiles, it absolutely made people's day to be thanked. Next slide, please. We also implemented a radiography handbook. So everything that we go for an induction, we wanted to have one central place where they could find it. Because actually, if you're a really great student and you're actually not sick very often, you might not know how to actually report your absence. So we wanted, actually, this has now come up now. I've not had a concern for 3 years, but now I've got a concern. How do I do that? So one central place, and that covers EDI support, safeguarding, wellbeing, where our hubs are. It was just a nice place for students to get all that information they needed. Next slide, please. So NET's on year on a year. So as a whole trust, you can see that in 2022, we had 20 responses. All the way up to 2024, we had 57, which is absolutely phenomenal. And the amount of reds has massively, well, the reds have gone. We've now just got a few pinks left. When you look at that single site, again, the reds are gone. There's still a few pinks. So there's still work to be done. But the work was phenomenal. And what I did was when it was 2024 and the results came out, I got that up and displayed it to the students. And one of the big things that came out of it was raising concerns. So 7 students said they'd raised concerns. 5 of those students said they told someone it was dealt with really well. But unfortunately, 2 people didn't report it. So we said, look, the people who have raised concerns said they had a really great outcome. So I don't know who those 2 people are, but if you do have the concerns, please come and speak to me, and just having those open conversations with the results as well. Next slide, please. We also had some really healthy competition at UHB. So as AHPs, every week we'd get an update of how many people were doing the NETS results. So we had really healthy competition. So it'd be us versus the physios versus ODPs. And we got 62 respondents this year, which is absolutely phenomenal. As a result of that, we actually got a few awards. Me and my colleague Ali's got Allied Healthcare Professional of the Year Award, and I got a Kind and Connected Bold Award. And actually, nationwide for AHPs for UHB, we had the most amount of NETS results across the nation, which was fantastic. One of the things we also did that was really successful is we got the students to promote the NET surveys, and they did TikTok videos. There was like a Disney Frozen epic thing, but the students loved seeing the people they knew, the other students, promoting it to them, and it made it fun. And we're getting the space and time to do that, which was really successful. Next slide, please. So lessons learned then, promote your NETs. You need to promote your NETs. The more people that do your NETs, the more information that you get. We know people who do surveys are really sad, really happy. We need to get representation from everybody. The more you do the NETs, the better. If you only got a few people doing it, that's enough in itself to get a visit. Have a practice placement manager, a dedicated person to look after your student. Make sure you invest in the well-being and the psychological safety of your staff members, because again, if you don't look after them, how can they look after your students? Keep evaluating, don't just wait till your NET surveys. Make sure there's multiple mechanisms of how students can raise concerns, and make sure they know. has systems in place, good communication, handbook, where possible a yearly rota, if not as far in advance as possible, so you can overcome those barriers. Make sure that PPM is accessible. And really, this is the EDI golden thread that goes all through SLEC, and it hits every single one of those standards. If you can't get your EDI right, you can't get the rest of your SLEC standards right. Thank you very much for listening. That's us finished.
Well, thank you so much. Thank you very much, Maria and Olivia. And it just demonstrates the power of nets and how we can turn things around, and also those practical applications as well from the lessons learned was really, really useful. Thank you very much. So next set of presenters, we have Laura Clifford and Kerry Woodcock, who are going to talk to us about building belonging. Thank you.
Thanks, Beverly. Yeah, I'm Kerry Woodcock. I'm Head of Professional Standards over at Lincolnshire, and I'll let Laura introduce herself while I get our slides up onto the screen.
Morning, everybody. My name's Laura Clifford. I'm the Head of Organisational Culture at Lincolnshire Partnership Trust.
Thanks, everyone. And we should have Candice Decato-Roberts joining us as well at some point, so I think she's here somewhere. Michelle, if you could share her too. Oh, there we go. I can see she's popped up now. Lovely. So we just want to talk a little bit about what we did in terms of some of our international nursing colleagues. So just to give you a bit of an intro, we were a bit late to the party of the international recruitment in mental health, I think, and we didn't begin our IR journey until about 2022. And we identified a couple of our clinical educators to kind of run an in-house OSCE programme. We'd looked at different OSCE programmes across the country and thought, actually, the needs that we've got in terms of our trust, we just didn't feel any single one met all of the needs that we'd got. So we actually developed our own internationally educated nurse OSCE programme in-house. What it meant was our clinical educators that had been identified were involved with our nurses that were coming to join us from kind of the interview stage. And then whilst those nurses were still in their country of origin, they had calls with them, they really got to know them and kind of formed a relationship with them prior to them landing in the UK for that OSCE. And they were heavily involved in the onboarding and pastoral support, and I know Candice will talk a bit more about that later. And during the 12-week programme, they made sure that we had time for things like engagement days, so time for people to link with estate agents, GPs, dentists, looking at the local environment, thinking about kind of cultural needs of the people that were coming to join us. They incorporated wellbeing sessions into that 12-week onboarding programme, which included things like mindfulness and managing your own anxiety, given that we knew that people were leaving families back in wherever they'd moved from, that they were coming by themselves, that it was a massive change. But equally, we wanted to really garner the fact that, we knew that the people joining us had some really great experience as mental health nurses, that we weren't getting brand new nurses, that we were getting people with some great experience, that we were getting some people with really good skills that we could really garner if we gave them the right kind of onboarding support, really, that we didn't just want people to feel like we were treating them like newly qualified nurses. That was not the plan. We wanted to really get to know people and understand where their skills laid and support them. So throughout that 12-week programme, we really worked with people as individuals to identify where their strengths were, what kind of support we could give them to kind of garner those, and look at succession planning, think about where would be most appropriate for them to work and access things like CPD and training. We invited every single one of our international nurses onto our preceptorship programme, which was actually a really good. There were some real positives that came from that, because some of their experiences really helped some of our newly qualified nurses and vice versa actually overcome some of those cultural differences. And equally, that pastoral support that had been in place pre and during the OSCE didn't stop when those people went into their first post, that actually we continued that support post OSCE, so that when people were moving into their first sort of nursing post within Lincolnshire, that actually the clinical educators still visited, did a lot of the pastoral support, continued with that, actually that integrating into that work environment and being support for that integration was really key as well. And I will hand over to Laura to talk about what we did post that.
Thanks, Kerry. So following on from what Kerry was saying, and the OSCE programme and the preceptorship programme, we really started wanting to think about career development and building a pathway for leadership for those internationally educated nurses that would like to progress. So I'm just going to talk for a couple of minutes about the programme that we introduced as part of this. And this programme really was designed to build a strong sense of belonging, confidence and leadership readiness among internationally educated nurses. The programme sort of created a real belonging by fostering peer connection, shared learning and a safe developmental environment. We utilised a number of frameworks such as the Strengths Deployment Inventory and Cultural Values framework, which enabled delegates to really explore their strengths, understand interpersonal dynamics and gain insight into cultural adaptation within the UK healthcare system. Delegates did repeatedly say how positive they found these tools and even describe them as transformative through improving self-awareness, conflict management and relationship building. We then, at the end of the programme, you can see a structure of the programme on the slide. The end of the programme included presentations and a celebration event that included senior trust leaders reinforcing that culture of recognition and belonging. Delegates really reported feeling valued and validated when presenting their learning journeys through personalised reflection, storytelling and peer celebration. An additional day was even introduced as part of this programme, which very much looked at career development and hearing from different people around the roles that were available at Lincolnshire Partnership Trust, supporting people to fill in an application form and interview techniques. So Kerry, if we can just go on to the next slide, thanks. So a little bit about impact in terms of the programme. Feedback, as you can see, showed unanimous high satisfaction, 5 out of 5 rating for course content, resources, facilitation, trainer knowledge and tools. I really like this phrase that delegates describe the programme as magic for helping them understand themselves and others, and several noted improvements in adapting to UK and LPFT cultural expectations. I think, you know, a central theme in the last presentation as well was around psychological safety. So this also created that opportunity to develop that, where sensitive topics could really be discussed openly. And this emotional support was praised directly in participant feedback. We also got some feedback from managers around their observations, which further validated the programme's impact on belonging. So both managers who responded reported self-awareness increase, improved team relationships and strengthened leadership behaviours in their staff. So you can see the impact was sort of really positive from a participant and manager perspective, and you can see also in terms of progression within the organisation, the majority of attendees have gone on to progress within the organisation into other roles, whether that be the next level nursing. Some people have done prescribing programmes and others have gone on to do further leadership programmes. So if we can just move on to the next slide, Kerry, please. You can see some of the quotes and some of the impacts sort of from a narrative perspective that the delegates have shared with us around the programme. Candice hopefully will be able to sort of, you know, put this into life when I hand over to her in just a second. And Candice has been involved in both of these programmes. So I think what's really lovely is Kerry and I can talk about the behind the scenes, the putting it together and the delivery. But what we'd really like to do is introduce you to Candice now to talk about how it felt, what Candice's experience was joining LPFT and having this in place. So I'm delighted to hand you now over to Candice.
And I will add that Candice also then joined us as a practice educator on the OSCE programme for subsequent cohorts, didn't you, Candice, which was fab.
Yes, thank you for the opportunity this morning just to share my experience. I would have come to the UK in July 2023, so I would have been part of cohort 8 at that time. And it was a culture shock, and it was a huge change from coming from where I came from in the Caribbean, having 16 years of nursing experience, and then coming to get into this OSCE program and to just learn new things, and learn new way of doing things that I probably would have done back home. So it was emotional. It was an emotional journey, having to leave family, having to leave my kids, only 4 months married, and then getting here and being provided with this huge book with all these things to learn. It was a bit intimidating. We had tearful times. Me and my colleagues, we were in tears. You know, there were times we felt like giving up. But I think the support we got from in that classroom, it was more than just preparing for that OSCE. They knew when we were overwhelmed. They knew when we were overwhelmed and we needed that time as a break away from the actual book work and preparation, and just gave us, as Kerry said, the mindfulness sessions where we practiced breathing. We dealt with our anxiety. They offered us safe spaces where they dealt with us on a one-to-one basis just to find out what was going on. And sometimes we would just step into that classroom because obviously we bonded. You know, it's 12 weeks in classroom. And I remember one day I stepped into the classroom. I didn't say anything. I didn't speak. And one of the educators was like, what's wrong? You know, do you need a cuddle? What's wrong? Do you need to speak? And took me into the room. And it was just like a really difficult day. It wasn't anything that happened per se, more than being drenched in the rain the day before. But I think when you're dealing with all the stressors, that was just that final straw when I felt like I'm done. I'm ready to go home. But they were supportive along the journey. We also had opportunities where obviously seeing on paper and knowing you have to look for somewhere to live and wanted to bring family, so you want the suitable areas. We're not familiar with the Lincoln area. We're not familiar with the UK. So we were also provided with the opportunities where practice educators scheduled it into our timetable, where we were driven around to Lincoln. We were shown the different sites of the hospitals where we'd be working. We were shown different areas. So it made this search for accommodation so much easier, because then we now had an idea, well, this is where you're going to be based. And when you see the areas on the letting agents pages, you know now, well, okay, it's closer to where I'm working. So it just gave ideas, because we were just looking at areas. And when in reality, when they carried us out, we realized it was miles away. So it just gave us all those opportunities. We were given opportunities to socialize. We were taken bowling. So we were not only introduced into preparation for being a UK nurse, but we were introduced into the UK culture and to the lifestyle, and just given new opportunities. Even when we prepared for that OSCE program, we were introduced slowly into some of the systems that we were going to meet on the ward. So it wasn't that we were just trained for the OSCE and then sent on our way, but persons from different departments came, showed us the different systems in terms of medication that we would meet, risk assessments and stuff that we knew that was not familiar with us, but we would have to face when we became qualified. Those were also introduced gradually while we were in classroom. So I think it was more than just you have 12 weeks to prepare for OSCE, but it was more preparation for life in the UK. And even when we were successful in the exams, they were there. I remember coming out of that OSCE exam and just doubting myself, and they were available for us to call. It wasn't that we had to wait till the next classroom day. We were able to call, we were able to cry over the phone and just share our feelings. So it was a proper support system. So we left our families abroad, but we came into that classroom and we got a new family, and gradually they introduced other persons from the trust. So they just widened that family network for us. And even when going to the ward, and I had difficult times doing my preceptorship, and I didn't feel comfortable yet speaking to staff on the ward, I was able to link back in with the practice educators in classroom and get that safe space. And they acted as the link to, you know, bridge the gap that I was experiencing on the unit. And even now, after having done the leadership, because even though I had the experience, it's a new system. So the opportunity with the leadership program, and then now I'm on the Merisical leadership program, again, is because of that practice education link, being able to speak to them about your ambitions, what you want to accomplish, and just getting that guidance. Yeah. And I also think in terms of, let's say, the opportunity, past cohorts, they came in while we were in classroom and they forged that gap, shared their experiences. And then, as Kerry mentioned, I was able to go back into classroom for cohort 9 and 10, and then share my experiences, and because I would have lived it now, so better be able to impart knowledge to prepare them for the OSCE program. And I think it was just a wonderful opportunity to be able to give back what was poured into me. And the fact that even now that I'm a band 6, I still have that support when I'm struggling, that I can just tap back in to the classroom and speak to them. I went back and I did a preceptorship training with them. So now I can support younger nurses when they come in onto the ward. So I just think it was just such a wonderful opportunity to be able to experience it. And I've spoken to colleagues who have gone to different areas. And while their training was not a complete 12 weeks, and it was just literally preparing for OSCE, you pass the OSCE, you're onto the ward, they don't have that connection still. So I think it was more than just the OSCE program for me. I think it was just getting a family when we came over here, because to be fair, they met us as soon as we came out of the airport, and they carried our bags up those flights of stairs for us and everything. So I think we just formed that bond with them from the beginning, and it remains. So I think it was a wonderful opportunity for me and for every other international nurse who came into the program with LPFT.
Wow, thank you so much. Thank you. Thank you, Laura, Kerry, and Candice. There is so much power in developing a sense of belonging for our clinical educators. And thank you, clinical educators, as well, for developing this around our international nurses as well, which is often can be a challenge, and particularly navigating the OSCE program. So thank you very much for demonstrating that, and thank you for sharing your story, Candice, and thank you for your honesty and transparency as well. So last but certainly not least, I'd like to introduce you to our final presenters, which are Noor Nixon and Anthony Hill, who are going to share with us inclusive training within practice. Thank you very much.
Brilliant, thanks Beverly. So in our session, we're going to be exploring the Inclusive Training Within Practice project, which I'll refer to as the ITP project. So I'm Anthony Hill, I'm the Dean of Learning Teaching for the College of Health Science Society at the University of West of England, but more importantly, I'm the Principal Investigator for the project. Noor, do you want to come in and say hi?
Yes, hello, I'm Noor Nixon. I work as the project lead, also working at the University of the West of England, and Anthony and I work very closely together on this project.
Brilliant, thanks Noor. So I did just want to start by saying, on terminology, this project uses the term Black, Asian and minority ethnic to refer to ethnic groups as defined by the Equality Act. However, we did just want to acknowledge that some organisations may use other terms such as global, majority and minoritised. And although we're not going to be going into any detail today, we will be referring to sensitive topics, including but not limited to racism, discrimination, systematic racism. So therefore, just wanted to give a trigger warning for individuals who may have been impacted by discrimination. I think the key thing, and it's come up in conversation previously as well, is learner experience of discrimination in healthcare education is very much a multifaceted issue. There is no single solution or one single element to pick up. And when we're thinking about our learners, how we support them, that's whether it's in the practice placement setting, it's in the academic education setting, that's in the preparation, and also it's our own training within healthcare education as well. So it sits in many places and is a complex and very wide issue. And the discrimination, the evidence that, you know, there's endless research projects from UE Bristol and BNSSG, ICS, Bournemouth University, the Two Hot Handle report that absolutely support these findings. And actually, before we go into the ITP project itself, I just want to say it was great to hear early on from Olivia Maria on how they proactively use nets as a prompt to drive real and meaningful change, and from Laura, Kerry and Candice on their superb support for internationally recruited colleagues, because it's absolutely the type of work that makes a difference and completely in tune with what we're discussing. So go back to the ITP project. So we started this in October 2023. And that was to develop inclusive, sustainable and scalable training packages on best practice to address racism and discrimination in both healthcare and education settings. And this is about enhancing, adapting or extending inclusive strategies to better support learners and international staff to foster a sense of belonging. And I think a key point here is what we've been very much doing is trying to help deliver against existing plans and strategies, whether it's SLEC, the NHS EDI improvement plans, staff survey outcomes, and for much more with my university hat on, looking at our rewarding gaps. And because I think one key thing, and Noel's going to talk in a little bit much more detail about what we've been doing, but in the ITB project, our focus is not about creating new strategies, but providing solutions to be able to deliver against existing ones, which is quite key. So obviously, with respect to the educator workforce programme priorities, this aligns immediately to 4, which supports educators' development and wellbeing, and 6, promoting equality, diversity and inclusion. So I've given a bit of a sort of a broad overview, but I'm going to hand over to Noel, who's going to talk you through in much more detail about the actual reality of what we've been doing.
Thank you so much, Anthony. So this slide just shows you our project on page, an overview of our project. And as Anthony mentioned, we started in October 2023, and we have now published all of the resources that we had planned in collaboration with a range of stakeholders. So the aim of the project was to improve the experiences and outcomes of Black, Asian, minority ethnic learners and internationally educated staff. So that links in very well with the international education staff experience that Kerry and Laura mentioned, but also the learner experience that Olivia and Maria mentioned. So we collaborated regionally across 7 integrated care systems, together with education providers, with placement providers, and we explored shared common challenges in order to develop training and learning resources that everybody can adopt and embed within their local strategies and policies. And so these we hope to develop tangible solutions that everybody can use, and you'll see shortly how we develop those. Next slide, please. So this was our collaboration approach. Through our regional and system collaboration, we identified 7 key areas for improvement. And you'll see those areas listed there. I won't go through all of those, but mainly anti-racism in healthcare and education, intercultural communication, learner supporting practice, and so on. So you can see there are 7 key areas, and we translated those into collaboration groups. The images you see there are our subject matter experts or consultant trainers who led these groups and explored the challenges, collected the findings, and then developed the content for the training packages we have. We also had a student feedback panel, because that lived experience and the voice is very important, and similarly an internationally educated staff panel. They fed into our drafts and our learning, and we also fed into a regional stakeholder group who are a reference group that feed in as well. So that's our approach. We have James at the top right there is our digital learning designer, who ensured that universal design for learning is embedded into the pedagogy, so that there is a learning journey for every resource that we develop. Next slide, please. So you might be wondering, what are these resources? They are a range of interactive e-learning packages, self-access tools such as videos, training slides, guidance documents, toolkits, and some trainer-led programs for cost-effective solutions as an option. Now, all of these resources embed 3 key themes that we identified was essential, and that's the importance of racial literacy, so that we can talk about race, racism and anti-racism, recognising that power dynamics come into play when it comes to minority ethnic learners and staff, and the challenges around reporting and accessing support, and bringing colleagues onto a journey to reflective and reflexive practice. So they're not siloed one-off training packages, tick box exercises that actually brings people into a process of reflection. We did think about the whole organisation approach. We started off with the practice education settings and learners, but actually identified that learners interact with colleagues across the whole organisation, and therefore a whole organisation approach is necessary to enable that systemic change. So we have published some resources for all staff that learning and development and EDI colleagues might consider. Some for specific roles, such as EDI leads around things like positive action, and a lot of resources for educators around practice education. And so those are all published on Learning Hub, and our core purpose is really to address the root cause of racism and discrimination. And the root cause is really within us, our biases, the environment, the education and learning that we've had, and bringing people onto a journey to dismantle those. So that's our aim. Next slide, please. So they are published on Learning Hub. Please do take a look. We encourage colleagues to explore the resources, look at the guidance on how to use the resources, and either adopt and embed those that are appropriate, or maybe adapt and extend your existing offer. And so please do have a look. Next slide, please. So we have published a lot of resources. We were ambitious and we wanted to maximise this opportunity that we had. So this table shows you the list of resources published, presented as the audience or staff group, so that it helps you to understand where you should go. For educators, the second column offers a range of solutions, and we thought today we could spotlight two resources. A learner supporting practice toolkit that offers best practice examples from across healthcare and across education HEIs. As a degree ethnicity awarding gap around for practice education, because through our collaboration we identified that colleagues, assessors, supervisors maybe were not aware of awarding gaps and how they might be contributing to it. It's worth noting, I should have mentioned earlier, that we had 100 collaborators from 16 organisations from across health and education. And so the feeding into designing these is vast, and the collaboration has been very positive, and I'll share a bit of impact shortly. So just going on to spotlighting those two resources. Next slide, please. So this is our Learner Supporting Practice Toolkit. It's available as an interactive PDF that you can download and take away, aligned to the Safe Learning Environment Charter and delivering against the Educator Workforce Strategy. The document offers the 10 SLEC priorities across the top that you can click through and navigate. And within each section, it offers you either resources for academic education providers or resources for practice placement providers. And these are real examples from organisations that are being used, and it offers examples of documents that you can download and take away, or it signposts you to websites. So we felt it was really important that we didn't recreate some of the work that we know is already out there, but to share this across the sector, so that we can maximise the opportunity to use these resources. In terms of usability, we made sure that it made it very clear that if you're a placement provider, where you need to go and the solutions that are on offer. And you mentioned, we listened to the NETS presentation earlier, and actually it lines very well. The learner passport was mentioned, student handbook was mentioned, and in this document you'll see additional examples of those documents that again you can download and consider for your local settings. And so hopefully this will be helpful for colleagues in practice education settings, both education and healthcare, so please do take a look. Moving on to the next slide. This is the next example of good practice. This is a video, a short 7-minute video on the ethnicity awarding gap and practice education. We felt this was necessary through a collaboration that students on healthcare programmes often spend 50% of their time out in practice. Now, the awarding gaps, which are unexplained, Office for Students note that this is likely to racism and discrimination experienced by learners, that we needed to raise awareness of this gap with educators, with assessors, supervisors. To help with this, we developed this video as an introduction to what the gaps are, what the data says, and what happens to learners when they experience racism or discrimination. But actually there is a positive at the end, that there are actions you can take to enable change. So hopefully this will be helpful for colleagues. Please do share for assessor supervisor training and for staff training opportunities as well. So that's the second example. Moving on, we're just coming to the end of our presentation. So how do you navigate these resources? As you saw, there's a lot of it. We would encourage you to head to Learning Hub using the link provided. And it's accessible to everyone. So whether you are a trust, a charity, independent provider, social care, everybody can access the platform. Please review how to use the resources and then maybe carry out a local gap analysis to identify the resources that fit your local need. Certainly for SLEC, the Safe Learning Environment Charter, there is a template available for gap analysis. And then to adopt and embed these resources, most of them are cost-free, so you can, they are open source, so you can just download and take them away and use them as you like. Some of them you can adapt and use the slides that serves local need. So that's the last slide. So the impact then, I mentioned, you know, what's been the reach? We have published on Learning Hub, which is a fantastic platform open source. We've had over 5,000 catalogue launches so far. We've launched nationally, and this is being used across regions, across England, and also being picked up by Scotland and Wales as well. Now, the benefits realised from multi-system integrated care collaboration has been realised through the feedback that we've seen, that whilst we are all working on these challenges individually, by bringing together diverse mindsets and diverse solutions, that we can produce solutions that are cost-free and impactful for everyone. So user feedback there on the left-hand side, you can see that the users and also those beneficiaries, the minority ethnic learners and internationally educated staff, have reported to us that this reflects their lived experience, and they feel that this is likely to have impact on improving their experience out in practice and in education. And so, next slide, please. I think just coming to the end. Just to note that this is a shared call to action for everyone across the organisation, particularly practice education leads, to review these resources and try and explore resources that might support your teams. Signpost your colleagues towards the resources to enable systemic change, but learning and development EDI are a good area to consider some of the all-staff training and learning. There are some peer support videos for internationally educated learners, which can be incorporated into induction and transition. And there are some resources for clinical mental health practitioners too, for culturally appropriate wellbeing offer. So that's it. Thank you very much. Next slide, you'll see my contact details. Please do contact me if you would like me to come to your meetings or you have any questions. Very happy to connect with you. And over to Anthony for final
Thanks.
words.
So just for 10 seconds, I was just saying, especially following Olivia, Maria, Laura, Kerry and Candice's talks early on, and I'm sure Nora as well, feel today it's been quite inspiring. So I hope everyone could go in feeling empowered. You can make a difference. So thanks so much for listening.
Thank you very much, Nor. Thank you, Anthony. Very powerful and a useful toolkit of resources there, which we will plan to share on our NHS Futures Educator Workforce Programme as well. So thank you very much. So with the time that we have, we did have a functionality for anyone to put anything in our Q&A. And we've been working with our colleague Ros. Ros, I don't know, have we got any key themes or anything that we can share or draw out with the time that we've got?
Yeah, we've got one particular question that's come up in the chat, which is just a request to Nor to talk through a little bit more about the awarding gap and how that applies from the perspective of practice educator, I think the person's job title was, and then just perhaps the theme that we go on after Noor across the panel is actually the impact bit, and making that happen, particularly from whilst the experience in Lincolnshire was very much putting the person before the process, some of the questions or the bits that got reactions to were about how do we move some of this to digital as well. So that's probably but perhaps Noor first, and then how do people make this stick is perhaps the theme that we pick up after that.
Thank you so much.
Have you got a few minutes to respond to that?
Yes, absolutely. Just quickly, the video will actually answer your question. But as I mentioned, the students spend 50% of their time out in practice. The awarding gap is a result of students having difficult experiences, which affects their confidence, their well-being, their sort of transition into placement, and therefore how they are received, the bias they may experience, certainly discrimination and racism they may experience but may not voice because of fear of reprisal, all adds to and with compounded effects on the student outcomes. And so it is an unexplained gap between Black and white students, Black and Asian students, which Office for Students say is likely to be as a result of racism. And so the role of educators and supervisors and assessors is key to improving that experience, particularly if students are spending 50% of their time with those colleagues. And there are things you can do to help. Thank you.
Thanks very much, Noor. So it's clear that the role of the clinical educator has a powerful leadership role within the workplace and with our clinical colleagues as well.
Beverly, sorry, it's
yes.
Roz here. Can you hear me? We've also got a hand raised. I've realised that Emily has got a hand raised. So if we've got a question from the floor, that would be fantastic.
Question from the floor. Go ahead.
See if Emily. I don't know if that's the technology may be defeating us.
Any other questions for any of our presenters?
If that's not worked, then I guess, because the other sort of theme was coming through of what people are doing digitally, wasn't how moving things through to being digital, and also for the team from Lincolnshire, that kind of what advice they would give for raising awareness of the impact from what they've developed, particularly I think the Lincolnshire provision noted that the off-the-shelf offer wasn't good enough. So how to, once again, it's about impact, getting it known. That was a question for the Lincolnshire team.
Open question, yeah. Question for Lincolnshire team or any of the other presenters.
Yeah, I think in terms of the impact, certainly for us, it kind of spread a little bit. We did have some other trusts that came to us and procured us our OSCE programme for their international nurses. So we had a couple of people who came from elsewhere within our kind of region. But I think, for us, it's the numbers speak for themselves. We had 45 people come through our OSCE programme and we've only had 2 move on. We've retained 43 out of that 45, which is phenomenal, really, considering, and, with 80% of them going on to get more senior posts and develop their careers however they want to. I think that's phenomenal, really. So making sure that we can kind of keep on that trajectory is great, making sure that impact is well known across our trust, but then also being able to speak at things like this to say, actually, this is how we've retained people, this is how we've managed to recruit people, but also that retention piece. For us, it wasn't just about getting people through the front door, it was about actually, once they're through the front door, how do we keep them and develop them and really make them feel like they want to stay with us, that was really important to us.
That is key, isn't it? It's key, retaining our staff, retaining them. We don't want a revolving door. So
no, absolutely.
Absolutely key. Yeah. Hi, Olivia, come in.
I was just going to answer the question about how we're making things a bit more digital and future-proofing. So one of the applications that we've started to use is Planner on Teams. I don't know if anyone's used that before. but essentially it gives you lots of buckets. So we have a bucket for communication, if people are absent, and what it means is we can assign people tasks. So if I can't do a check-in with somebody, I can assign somebody a task on another site who can go and check in on that student. So digitally we're exploring that and have implemented that at the moment. We're also trying to make a Teams page or a futures page for our students so that actually they can have a live rota. So every time we make a change or reasonable adjustment, I'm not just sending them as an email new rota, they can see a live version, which makes it a bit more digitally connected. So yeah, absolutely, the handbook is going to be changed into a web page. It's just a work in progress. Thank you.
Thank you. Thank you very much, Olivia. And so we've come to the end of our first EDI webinar for the Educator Workforce Programme. I want to thank everybody who's been involved in the development, our presenters, Ros, Michelle, everybody, the whole of the Educator Workforce Programme team, everybody who's attended. As mentioned earlier, we did say that the presenting is being recorded and we can upload that onto our NHS Futures EDI webpage or the discussion forum. So it will still be available for the engagement to continue. So on behalf of everybody, I just want to say a big thank you. Thank you for engaging. Thank you for attending. Thank you for your questions, and have a great day, everybody. Thank you very much. Bye-bye.